My name is Stephanie, and today I met with Dr. Cruz and considering rhinoplasty. I'm considering having my nose done because I look at my face and I'm like, you know what, that can be corrected. I'm 25 and I'm at a new stage in my life, and I just graduated college and I'm about to start a new job, so I really wanted to get this out of the way and done, and step forward into the direction that I'm going in.
Hey, how are you? Thanks for coming by.
Thank you.
We took some pictures, and I'd like to actually put them up on the screen, and we can go over what it is that we want to accomplish. What we want to do is we want to go over the nose, but we can't just look at the nose because the nose is actually part of the face.
Okay.
And the way I look at it is I divide the face into thirds.
Okay.
Really from the level of the brow to the hairline, and then from the brow to the bottom of the nose, and then from the bottom of the nose to the chin. And what I see when I look at you, Stephanie, in this picture, is that the middle portion, the middle third, is large, mainly because of the nose. So what we certainly need to make the nose smaller. But what we need to also focus on is that the chin is small. We need to make the chin a little bit larger in order to make your face more proportional.
Okay.
And I would much rather bring the nose down a little, make the chin a little larger, than to try and just bring the nose down a whole bunch, because this is going to actually put you in proportion as opposed to just making the nose smaller. The reason why Stephanie is such a good candidate is because she's inherently very pretty. But the problem that Stephanie has is that her nose is so disproportionately large compared to her face that the person who's looking at her is distracted by her nose. So what I have to do during the surgery is to reduce the size of the nose so that you can get past the nose and look at how pretty her eyes are and how pretty her facial skeleton is. Would you like to have a slight concavity? It adds a little bit of a feminine quality to it, or would you like to keep it straight?
Let me see what it looks like
With a
concavity.
slight concavity. Okay. So what we'll do is we'll bring this down just a little bit more. And we're not talking large differences, we're talking minor differences, but minor differences on the nose make a big difference. Okay, so that's a slight concavity.
Okay.
Let's go ahead and see what you would look like if we were to just enhance your chin just a little bit, because the goal of what we would want to do for your chin is to bring the anterior portion of the chin to the level of the lower lip. So we're looking at about a 6 millimeter advancement, and that dramatically make your nose look smaller, but it's also going to give just stunning definition to your face. And let's go ahead and do that. So what we're going to do is to bring the chin forward just a little bit. We don't want to make you look artificial, just a nice natural look. Performing a chin implant has a lot of powerful effects, and one of them is that by making the chin look larger, the nose ends up looking smaller. And when you look at Stephanie, her chin is behind the level of her lower lip. So what I'd like to do is just add a moderate chin implant just to bring the projection of the chin to that of the lower lip. That's going to give her face much better proportion, and it's going to make her nose look smaller. Now you can see just by doing that, the more projected chin makes the nose look smaller, and it's just a wonderful thing. I think we're going to get a great result. Really, doing both of them together is going to get us where we want to go.
I'm very excited about it. Just what you showed me here, it's a drastic change, but not too drastic, where it still looks natural and smooth and nice and feminine.
She's got wonderful cheeks, beautiful eyes, a large nose as well. So by making the nose smaller, enlarging the chin, it's going to bring out her cheekbones, it's going to accentuate her eyes, and it's going to give her a triangular face.
The consultation went great. I thought I was just coming in for a rhinoplasty, but speaking with the doctor and viewing it on the computer, he really got into depth as far as the whole facial structure, and not just to focus on my nose, and to have things proportionate, and that's when he recommended having a chin implant placed. I'm really happy, and I'm going to go for it for the 2 procedures.
Good morning, Stephanie. You nervous?
Yes.
All right. Well, I would expect that. But just remember that when you wake up, we're going to make sure that you have no pain, because we can easily numb up the nose and then numb up the chin.
So how long does that last till?
It's going to last about 8 hours, actually.
Oh, 8 hours, okay.
By the time you make it home, and then we'll have you taking some medication. But really, the whole process is not going to be very painful.
Okay.
Let's just go over what we talked about, because there's really essentially 4 things on the nose that we wanted to accomplish.
Okay.
One of them is we want to get rid of this hump. We're going to bring that hump down to make it straight, actually just a little bit concave, just a little bit of a curve, nothing significant.
Okay.
Also, we want to then just bring the tip up just a little bit, and then to narrow the nose, and then the last thing is to define the tip. I'm really excited for you. I think this is going to make your nose just really in balance with the rest of your face. So when people look at you, what they're going to look at is your pretty eyes. They're not even going to see your nose, except that the nose is a lot more in balance with the rest of your face. All right?
All right.
I'm looking forward to it. We have Stephanie numbed up at this point, so the numbing medication lasts for about 8 hours, so she's going to wake up without feeling any pain in the nose. And in addition, it also helps with cutting down on any bleeding. We're ready to go. We've gotten exposures to Stephanie's nose, and we've separated the cartilage from the bone, and now we're going to begin to take the dorsum down in a very systematic method. By separating it into components, it allows me to very accurately decide exactly what needs to be taken down. Now, you can see that we've taken the hump down, the majority of the hump down. Now what we're doing is we're going to do just some fine rasping in order to get the edges that are sharp, to bring them down. Okay, so we've taken down the hump of the nose. I'm very happy with the way that turned out. And then we've shortened the length of the nose, so it's going to come up just a little bit. And now what we have to do is actually narrow the nose. And this is particularly important because when you take a hump down, the nose will always look wider because you don't have as much projection. We're done with the nose, so we're going to be starting the chin now. The chin will give her a more elegant, triangular, defined look. So we're going to be doing that through just a small incision just underneath the chin. All right, well, we're done with the rhinoplasty, and I'm very happy with the result. We accomplished our goal of bringing the hump down, narrowing the nose. Overall, I think it went very well.
I smile bigger when I take pictures now. I'm not so worried about like what angle I look best in pictures, like with friends or family. I can focus on bigger and better other things that are going on in my life now instead of worrying about like my physical attributes, which, you know, going to Dr. Cruz, and he's helped me so many ways. Like, now when people pay me compliments, I take it graciously and I honestly say thank you. And now I'm just so much in a better place than where I was 2 months ago. I can believe how much everything has changed within this time frame. So it's great. I feel great. My kids went through this whole process with me, and everybody's just had great attitudes about it. And now I feel like everything is complete.
I'm really excited about Stephanie. She's a very pretty girl. She just was concerned about her nose, and she didn't really want to change anything else about her. All she wanted to do was to reduce her nose to make it much more proportionate with her face, and to enhance her chin, give her a more triangular look, and I'm excited because we were able to do that.
I'm very, very fortunate that I met Dr. Cruz and that I had the opportunities to get all of this done. I just really would like to thank everybody that works with him. They've all been such a positive influence in my life. From the anesthesiologist to like the recovery team, the nurses in there. I mean, everybody was just awesome. Now it's on to bigger and better things.